Hello everyone, my name is Robert. I have MG. I hope you're doing well out there in the MG community. This is the second video talking about your MG meds. I'm here to talk about your infusion treatments or your intravenous treatments. Specifically, we're going to talk about the big four: IVIG, Plasmapheresis, Rituximab, and then Soliris, which is a relatively new medicine. I've had the first two, but in general, these four treatments focus on the antibody, and that's our enemy with MG. That antibody is that Y-shaped protein in your blood. That's normally a good guy. It tends to fight off the things that want to do harm to our body, want to infect us. That's our immune system. But now it's gone rogue and it's blocking the things that we need. That's why we have the MG symptoms. So we need to fire those guys and we need to replace them with good antibodies. And that's what an infusion treatment does. Now, these treatments are not sold over the counter or the prescription. They're very expensive to come by. They need to be administered in a clinical setting, usually an infusion clinic, maybe a hospital. If it's at your home, it's got to be with a registered nurse, so they're expensive. And they may not be approved by your insurance company right off the bat. They don't see these as maintenance treatments. Usually, if you're in a crisis, you're going to receive one of these, but you may continue to have symptoms that require an infusion treatment. And if you're denied, all I can say is fight, because I don't want to get into all the insurance issues, but the bottom line is wherever you are, you need to be your own advocate. And getting infusion treatment is very important. Get your doctor on your side, help them fight for you. And I certainly hope that you can get the treatment that you need. Let's talk about IVIG. That's the most common treatment, and essentially intravenous immunoglobulin. Globulin is just another word for antibody. It's a blood protein and it's a donor product. So without blood donors, you don't have IVIG. It's not just used for myasthenia gravis. A lot of autoimmune diseases use IVIG. People, viral infections, they need those antibodies to be infused. So that's where IVIG comes from. It only lasts about 30 days. It usually takes a couple of hours to administer, maybe a little bit longer. You can take your infusion treatments, by the way, alongside your oral medication. If you're taking prednisone, Cellcept, those go in concert with each other. I've had about 8 IVIG treatments, and yes, I had to fight to get some of those approved. Side effects, they're going to vary. I was just very tired. I was cold. You may feel nauseous. You can just Google some of those side effects. Plasmapheresis, it's a blood product. Albumin, which is plasma, and it comes from donors. You know, when you donate blood, sometimes people donate plasma, and that's where that comes from. That albumin is a blood protein, and it's filtered through your blood, the pheresis. So a lot of times it's a little bit like kidney dialysis. Some of your blood is returned, some of your blood is retained, but essentially it cycles in new antibodies. Now, it takes about 6 days for this treatment, 6 different treatments, and it needs to be done in a hospital setting. I was in ICU when I had my plasmapheresis, and it affects people differently. For me, all it really did was stabilize my breathing. Didn't do hardly anything for my other symptoms. It brought them back temporarily, but then I had to go back to IVIG, because remember, we're all snowflakes. But that's plasmapheresis. Another infusion treatment for MG is Rituximab or Rituxan. Now, it's a man-made antibody, but it's also a protein used for other autoimmune diseases such as rheumatoid arthritis, but it's also used for certain cancers like non-Hodgkin's lymphoma. So it's used for multiple things, much like IVIG is, plasmapheresis as well. The bottom line, it's trying to give us the good antibodies. I think it has something to do with the B cells in your blood. I'm not really sure, because I've not dealt with Rituximab, but we have some people in our group that have taken this. The bottom line with all these treatments, Soliris included, that's the new one. It's very expensive, and there are certain companies that produce that. Remember, all these treatments are produced by different companies, just like different brands of cereal. I took GammaGuard for IVIG, and I thought that was IVIG. Don't know, that's just the brand of it. These treatments are produced by many companies, and that's a good thing, because there's a little competition in the market out there. The bottom line through all these medications that I want to stress to you is that it's still important that what you eat should be considered as a medicine. Now, don't get me wrong, healthy eating is not a substitute for good medicine, and the opposite is true. Good medicine is not a substitute for eating junk and having unhealthy eating habits. Those two go hand in hand, and you need to find the balance. And yes, I would prefer to just eat healthy and have a healthy lifestyle and have less of the meds. But you need to listen to your body and you need to listen to your doctor. And none of these meds work instantaneously. Remember, with MG, it's a slow process, and it is a process, and it's going to take time. It's been 2 years after my myasthenia crisis, and I'm still, even though I'm in a maintenance mode, I'm still taking these meds to maintain my body and to continue to gain strength because I still have some of those symptoms of fatigue in my body. So don't be discouraged. You're going to get better. You're going to get stronger. But the medicines do take time. Listen to your body. Listen to your doctor. And for me, the foundation of all this is prayer and faith and family. So take care of yourself and be well.